What are the social determinants of health? Social determinants of health are the societal, environmental, cultural, and economic conditions in which we live, work, and play. Why is it important for us to talk about this? The social determinants of health are the most powerful predictor of health and welfare of all communities and individuals within that community. Understanding the social determinants of health can provide us with a foundation for knowing where to most effectively intervene to affect sustainable change for healthy people and communities. Good day. My name is Dr. Neal Palafox, and today I will be talking to you about the social determinants of health. As we go along life within the communities in which we live, work, and play, we sometimes become unhealthy and fall off the edge of health and become sick. The community that lives with us, of course, is at the top and in their healthful state and watching what happens. And what does happen? Well, if we become sick and ill, we can have an ambulance come and pick us up. Or sometimes before we get to the stage where we need an ambulance, we have what's called a health net, which catches us before we fall to the bottom of the cliff. Or we can have a fence at the top of the cliff, and so that we don't fall off in the first place. Or what can happen is we can back up the population from the edge of the cliff so nobody falls off and becomes ill in the first place. And in this model, each of this has a name. So on the right side of the cliff where the ambulance, the net, and the fence are, it's called a medical model of healthcare. And the social determinants which move the people back away from the edge of the cliff are elements like a good education, good jobs, good finances, good cultural assets. Sometimes understanding social determinants of health can be understood in the context of disparity. What is disparity? Disparity is the lack of parity or the lack of equity. Things aren't paired. So if you compare communities, what happens is in some communities, there is no ambulance to come and pick you up if you get sick. Sometimes there's no net to catch you from falling all the way to the bottom of the cliff. And at times there's no preventive measures at the top of the cliff to prevent you from falling off in the first place. And what we have to work with is populations in disparity are always towards the edge of the cliff. And in the model of social determinants of health, why are they there? It's because unlike the model at the top, they have poor social determinants of health. So they have poor education, they're mostly living in poverty, their cultural assets are not strong, they have elements of racism which push them to the edge of the cliff. So they're always at a higher risk for falling off the edge of the cliff. Your healthcare status, as we portrayed in the previous slides, is really determined by many different things. It can be determined by your gender, if you're male or female. It can be determined a little bit by your genetics. It can be determined by your healthcare access and healthcare itself. For instance, what was on the right side of the cliff, where the ambulance were and the health net and the fence were. But it can be also determined by the social determinants of health, which are the environment you live in, the education you have, and the income that you have. So when we look at these and their structure, healthcare access, as it turns out, only affects 10 to 20% of healthcare outcomes. Most people think that it's the hospitals, it's the clinics, it's the medicines that determine how healthy an individual is. But in actuality, when they looked at it in many different studies, they have found out that it's actually the environment that you live in on a daily basis that determines your health status. And this is your income level, your education status, and the built environment and your cultural environment. So for instance, if you live in a healthy environment, it would mean an environment where you usually have a better income, that you do not live in poverty. The people who live in better healthy environments are people who live in communities with a higher level of education. If you live in a healthier environment, it means that the physical environment around you is a better environment. You have more sidewalks. You do not live in in a polluted situation. There's not as much crowding. So when we look at the determinants of health status, we have found out through science and by working with this for many, many decades that the most powerful effect on your health care is your income, your education, and your environment. Healthcare access in and of itself actually affects only a very small proportion of how healthy you are. And that's why understanding the social determinants of health is very important. There is scientific evidence about the power and the effect of the social determinants of health and the healthcare status of individuals and communities. These are studies that have been done between 1993 and 2012. And what is important in this slide is that healthcare at the bottom only affects between 10 to 25% at the most of your healthcare outcomes. And so, in other words, as an individual or as a community, good healthcare, your clinics, your ambulances, your immunizations, if all of that work perfectly, and I mean perfectly, it would only determine 25% at the most of your healthcare outcomes. All the rest of it is determined by the social determinants of health, your socioeconomic status, your physical environment, your social environment. So the social determinants of health in many studies have the greatest effect on the healthcare outcomes of all communities and individuals. And it's in this realm that we must intervene and learn how to intervene to create good, healthy societies and peoples. This slide is a schematic of population health, which was put together by Kindig and Stoddard in 2003. And what this slide depicts is that health outcomes and the distribution of good and bad health in a population is really determined by the patterns of health determinants over the life course. And the patterns of health determinants over a life course really are the social determinants of health, or predominantly the social determinants of health. Again, it's your education, levels of poverty, your levels of wealth, your cultural assets, and your built and physical environment. And so those are the largest determinants of the health outcomes and distribution of the health outcomes within a population. So where can we intervene? We can intervene schematically by doing different policies and interventions at the individual and social level. And that's how this model fits together. We as people who do public health, who understand health, and who wish to make health of the society better, this relationship of the patterns of health determinants over one's life course, how it affects the health outcomes and distribution of the health outcomes of a population can be changed. And it can be changed by, again, different interventions, different policies at the societal, the medical, or individual level. And that's why this talk about the social determinants is so important. It's because the social determinants by far have the most powerful impact on the health outcomes of any population or on any individual. Thank you very much for joining us during this presentation, and maybe together we can create healthier communities through understanding the social determinants of health.